my name is Angela Fellers-Lemire, and I am the nurse consultant for the Women's Wellness Connection program. Today, I will be reviewing aspects of breast cancer screening and diagnostics within the program. Adherence to medical policies and guidelines is essential to reimbursement for individual clients. Reimbursement cannot be made in cases where WWC guidelines have not been followed. Policies and guidelines are evidence-based and compliant with the Centers for Disease Control and Prevention rules for funding. Basic screening services must be provided on-site as an office visit. Clinical services other than basic screening services may be carried out by a WWC agency or through subcontracts with other agencies. Examples are mammograms and biopsies. Each agency is responsible for the care and follow-up of clients it enrolls into WWC. In other words, each agency must navigate and case manage the clients it enrolls. Breast services include obtaining a breast health history, providing breast health education, and may or may not include a clinical breast exam. Services also include an annual mammogram. The breast health history must be recorded in the patient's health record and include questions about personal history of breast cancer, first-degree relative with breast cancer, and if any new breast cancer symptoms have been experienced during the past 3 months. Breast health education must be provided to receive reimbursement for breast services that do not go beyond the B1 level of the BPS. This education must be provided by the provider or other trained clinical staff. Breast education at a minimum should include current recommendations about screening intervals and information about the risks and benefits of mammogram screening. Clinical breast exams may be provided annually. Yearly breast exams are considered optional by WWC based on the provider and the client's determination of need. Performance of a breast exam is not required in order to receive reimbursement at a B1 level of the BPS, but obtaining a breast history and discussing breast health education are. Screening mammography is covered annually for patients 50 to 64. They are also covered for women 40 to 49 years old if they are determined to be high risk for breast cancer or if targeted screening mammography counseling has been completed. So what about those average risk women between the ages of 40 and 49? WWC supports the USP-STF 2016 guidelines that state the decision to start routine screening mammography before the age of 50 should be an individual one. Women who place a higher value on the potential benefit than the potential harms may choose to begin screening between 40 and 49. In WWC, we call this targeted screening mammography and encourage a shared decision-making process between the clinical staff member and the patient in order to decide if a screening mammogram is right for them. I want to talk a little bit more about breast health education. This education should include information about breast cancer screening intervals, the risks and benefits of mammogram screening, risk factors for developing breast cancer, symptoms of breast cancer, and how to reduce the risk of breast cancer by staying physically active with regular exercise, maintaining a healthy weight, avoiding hormone replacement therapy or HRT, and knowing the risks and benefits of HRT and if it is the right option for the client. It's also important for patients to know that limiting alcoholic beverages can reduce their risk. NBCC EDP's Breast Cancer Facts patient handout can be used to meet this education requirement. In January 2016, the USP-STF released final breast cancer screening guidelines. These guidelines are very similar to the 2009 and the draft 2015 guidelines. If you are unfamiliar with these screening guidelines, I encourage you to visit the 2 links shown here. The Screening for Breast Cancer link includes a short video that explains the new and final guidelines. Diagnostic services are covered for all clients eligible for WWC if they have breast symptoms, abnormal CBEs, or referrals for diagnostic workups. The 2011 Breast Cancer Diagnostic Algorithms for Primary Care Providers must be used by WWC agencies to guide clinical decision-making in the workup of breast abnormalities. These algorithms are meant to be used as a guide to help work up abnormal findings and/or breast complaints. WWC-approved diagnostic procedures include diagnostic mammogram, MRIs that meet specific criteria, film comparisons, ultrasounds, ductograms, surgical consultations, and most breast biopsy modalities. CAD, or digital breast tomosynthesis, also known as 3D mammography, is not a reimbursable procedure in WWC. Surgical procedures on benign breast masses for cosmetic or pain management reasons are not reimbursable procedures in WWC. Breast ultrasound and MRI as screening modalities are also not reimbursable procedures. If you have any questions, please be sure to contact the nurse consultant or your program coordinator.